Hey guys, today we're going to be talking about 4 stability exercises for the spine. Now whenever a client comes in to see me, I'm going to evaluate them. I'm going to be assessing what's going on with them, whether that be something age-related, degenerative, or disc or movement-related. So each person is a little different in how they will approach their rehab, but these 4 exercises I'm going to give you are fairly safe for everybody across the board. So let's go ahead and get right into them, okay? So first one I'm going to do is the dead bug. So this one, we're going to be on our back, okay? And if you have the ability to stay in a neutral spine, which means you have that little bit of that slight curve in your back, stay here. But if you feel like it doesn't support your back, then you're going to think a little bit more deeper flattening through the spine in this position, okay? So I'm going to have you bringing the legs up to tabletop position. So thinking again that deep activation of the abs, pulling down. And I like to bring one leg up at a time because it supports the back a little bit better, okay? Initially I have people start off with just the legs, and then eventually we add the arms on. So let's just start with the legs here, okay? Again, I'm thinking that deep pelvic floor lift, deep abdominal activation, and I'm gonna be extending the legs in and out, okay? If this is too high level, or if somebody's feeling pain with this, I can have them come in a little closer and stay in this area here. Really, they're thinking that those abs are really drawn down in that position there, okay? If I was to add the arms on, I'd be doing this opposite arm, opposite leg motion here, okay? And I can get out a little bit further as I get stronger. But again, if you have just started experiencing low back pain, I'd probably keep it a little bit closer into this area, and I might not even add the arms in right away. Okay, next exercise we would do would be bridging, okay? I'm gonna put my heels a little bit closer to my hips to activate more of the glutes as I'm lifting up. Glutes are a big powerhouse for the spine. So in that position, I have the arms out by the side and pressing lightly into the ground or the mat. Okay, again, I'm gonna think that pelvic floor, and then I'm gonna go ahead and activate the lower abs. I'm going to lift through the hips. And here, we're having this position where we want to be hinging at the hips. We're trying to keep a nice stable spine, and also we have a nice stable femur here. So we're hinging right at this point. We're lifting up and then coming back down. Good. And at the top, I'm thinking these abs are here, and I'm thinking these glutes are on. So it takes the pelvis and effectively posteriorly rotates it a little bit here to support the spine better. Good. And again, with this one, we're not going to go way high, too high, okay? It's not meant to be a mobility bridge. This is meant to be a stability bridge. So that means that we might feel a little bit of the back working, but we're not overworking it in this position or compressing that lumbar spine there, okay? So again, up and down through there. Good. All right, next position we're gonna do, or next exercise we're gonna be doing is the bird dog, okay? I like people to find that neutral spine position, okay? So sometimes we just move that pelvis until we find that place where we have a little bit of a curve in the spine. From there, we're thinking again, pelvic floor gently lifted, lower abs turned on, and then we're gonna be extending the opposite arm and the opposite leg out from that position. And while I'm doing this, I'm thinking also just that I have this nice foundation of the arm that's down into the mat and the opposite leg pushing down into the ground and stabilizing. Good. And with this one, you can either just alternate if that feels safe and stable for your back, or you can hold it as a little bit higher progression with that. Okay, and again, and moving again just at the shoulder joint and the hips, the spine is not moving in that position. Good, and if you feel a little bit sore with this, you can think a little bit flatter back if you want to in that position, but I don't want you to be here rounded. It can be just slightly flattened. After I do that one, I usually have people take a little bit of a stretch to open things up just for a minute, and then we might go into the Superwoman exercise. And yes, I did say Superwoman. So we'll be down on the ground. If somebody does not like this position or feels painful for the back, I might add a pillow or two underneath their stomach to put their back in a little bit more flexed position or neutral. Okay, so we'll be in this position. Head is just hovering off the mat. And then I'm just gonna think light activation of the pelvic floor, lower abs,
and then I'm lifting the opposite arm and opposite leg up. And I'm just kind of hovering them up and down. I'm not thinking that this is a hard exercise because it's really meant to be an endurance exercise. The muscles of the back for these exercises are meant to be endurance or stabilizers, not big power muscles here. And again with this one, you can either alternate or you can hold. So this one I might hold for 15 seconds. And then I would switch. Good, and as I'm doing that, I'm thinking a little bit of the glute activation. Again, head is just staying nice and long through the body. When I finish there, again, a nice little press back into that position just to get a quick stretch and open things up is great.
So try those exercises, let me know how your back feels.